January echo session for our hypertension and cardiovascular disease echo series. Um, we'll start off with the introductions, and then we'll go into our didactic presentation that's going to be presented by Monty Robertson. This is his second presentation with us, and we're really excited that he's joining us again. And then we'll go into our questions and discussion, give some information about our next session, and share our information on our survey and close out our Echo series. So we will start with our introductions. I would love for our subject matter experts to start introducing themselves. And I see Emily Ridley here first, so I would love for Emily to start.
Hi, well, good afternoon or good morning, depending upon your location. My name is Emily Ridley. I'm a clinical pharmacist based out of an internal medicine residency clinic within Prisma Health in Columbia, South Carolina, where we did get some ice and snow, not as much as at Gulf Shore, though. Well, in our clinic, we serve primarily a low-income urban and rural population of patients, and I've worked in our health system and quality improvement efforts regarding hypertension control, and also have served as a consultant with PAHO with the Hearts in the America program. Looking forward to Monty's talk today. Thank you.
Thank you, Emily. Dr. Tepetti.
Well, hello, everybody. And again, thank you for having me as always. Don DePetty, I'm the Health Sciences Distinguished Professor here at the University of South Carolina and South Carolina School of Medicine, former Dean of the School of Medicine as well. I'm a primary care internist by trade. I did fellowship training in hypertension and vascular biology, but still remain a general internist. I also serve as an advisor for PAHO, as well as former president of the Southern Medical Association, one of our constellation partners. And it's just a pleasure to be here. And I do look forward to Monty's perspective today.
Thank you, Dr. Tepetti. And Dr. Bretler.
Hi, good morning and good afternoon, everyone. Jeff Bretler. I'm an internist and a hypertension specialist from Los Angeles. I help co-lead the hypertension program in Kaiser Permanente in Southern California. I'm on faculty at the medical school there, relatively new medical school. Also serve as a consultant along with Don for the Pan American Health Organization. I'm excited to be here and to hear the presentation. Thank you.
Thank you, Dr. Bretler. Thank you. If additional SPEs join later, we will go ahead and put their introduction in our chat. For our participants, please share your name, your employer or your organization, and your position and credentials in the chat. This is information that we just like to capture during our echo session. All right, we will move on to our presenter. Before I hand it over to you, Monty, I just want to introduce Monty to our participants. Monty is from a small town in South Carolina. He did receive his bachelor's in biology, and he also holds a master's degree in health administration. He is currently the executive director for the Alliance for Healthier South Carolina and works with over 60 organizations to improve the health and well-being of communities in South Carolina. He is also one of our key advisors on our advisory board for the Constellation Regional Collaborative and has been a great advisor and collaborator in the work that we do. So thank you, Monty, for being our presenter. Thank you for the incredible work that you do across South Carolina. And I'm going to hand it over to you now.
Thank you so much. Thank you all for having me again. I'm glad must not have done too badly or poorly the first time. So glad you guys have me here today. So I know my first presentation, I really talked about my grandparents and their journey with managing hypertension. And so this presentation today will delve a little bit deeper into really the role of healthy eating and active living to really manage hypertension or really combat it. So Looking forward to running through this presentation today and want to hear any insight that you guys have into this subject as well. Just like before, just an disclosure, this is just information and education purposes now, and just my personal experience, and should not be construed as professional medical services. So any specific health concerns, including hypertension, you should contact your healthcare provider or medical professors. One kind of caveat to that, I'm a certified personal trainer and a certified nutrition coach. So different from a nutritionist, nutrition coach, kind of the scope of practice really is evolved around providing general guidance around as it relates to food and nutrition. So, which is what we'll be talking through today, on things that I've seen worked with people I've worked with. So certainly, again, we'll love to hear you guys chime in on any ideas you may have or experiences you guys may have. So 2 objectives today really around promoting diet and exercise. So just really talking about the role of healthy eating and physical activity in preventing hypertension, and then share some actionable tips for preventing hypertension through lifestyle changes. Next slide. So real quick, just do want to give just a little bit of information about the Alliance for a Healthier South Carolina. So I serve as the executive director of this alliance, and really excited about the work that we're doing to improve the health of South Carolina. So as you can see here, our vision is around the South Carolina with optimum and equitable health for all. And our mission, we really centered around convening, connecting diverse stakeholders to align and catalyze efforts to improve the health and well-being of communities across South Carolina. And so right now, we're really excited to be partnering with the South Carolina Department of Public Health to develop the State Health Improvement Plan, which will be a 5-year plan to really help raise the status of health in South Carolina. And so really excited that 2 of the priority areas in this plan are centered around healthy eating and active living. So how do we change systems that promote healthy eating, active living, but also how do we provide better education and support to communities across South Carolina? So we're really excited about that plan. Once we have it squared away, I will be happy to share it with you all and get you guys to participate in this process. Next slide. So before we jump into talking about any specifics on healthy eating, active living, I thought it was really good to really see what the data says. So very fortunate our partners at Department of Public Health provided some data as it relates to hypertension and other areas, specifically around chronic health conditions. So I'm going to run through some data real quick. And again, this is provided by Department of Public Health. So next slide. So again, starting with just looking at hypertension generally. So, and this data, of course, with data it lags some. So in 2021, we saw about 38% of adults reporting being diagnosed with hypertension. And so while we're at that number, it's remained stable over the last 10 years. And so certainly I'm glad it hasn't gotten worse, but there's opportunities for improving these numbers across the state. From a disparity standpoint, as you can see, the non-Hispanic Black adults see about a 20% higher rate of being diagnosed compared to non-Hispanic whites, and 2.7 times higher rate for our Hispanic community. So again, we see these disparities, especially with our Black community, and certainly want to make sure we have more equity-focused strategies to address hypertension with this community. Next slide. So just drilling down a little bit into this data, we can see that Allendale County has the highest rate of hypertension at 65%, which is really, really high. And so, of course, may be there's certainly some implications behind that. Certainly there's some drivers behind that. And so we really have to dig deeper into understanding why numbers in Allegheny County are so high. And then the lowest rate is Richland County, which is 33%. And certainly, again, same thing on the other side. Are there things, our rural communities, we can see are more disproportionately affected by hypertension. And so how do we address some of these issues specifically with our rural communities? And then, again, there was over a 30% difference in the highest and lowest counties. And so even from county to county, we're seeing great disparities when it comes to the prevalence of hypertension. Next slide. So let's take a look at stroke. Next slide. So as it relates to stroke, looking at the past 10 years, we can see that stroke death has actually increased, not a lot, but still has increased by 6.4%, with the rate of 48.4 stroke deaths occurring per 100,000 people from 2021. Again, this understand this data lags a little bit, but still gives you the context of where we are. And more specifically, we're looking at by gender, or sex. We can see that 11.8% higher death rate from stroke in men. And then if we look at it from a racial standpoint, we can see that non-Hispanic Black sees about a 50% higher rate compared to non-Hispanic whites, and 2.3% higher than the Hispanic community. Next slide. Stroke deaths, again, taking a look at this by county, we can see that Darlington County has the highest stroke rate of 95% per 100,000, and Beaufort with the lowest at 29.2 deaths per 100,000. And then specifically looking at Darlington County, saw a 3.3% higher rate of dying from stroke than Beaufort County. And so again, we're seeing from county to county huge disparity rates. And in many health issues, we can see that the PD region in our state sees the highest rate. Again, there's often we have a conversation, we talk about the I-95 corridor, and this area of our state still experiencing great disparities when it comes to health outcomes. Next slide. We'll jump to looking at heart disease. So specifically looking at coronary heart disease in the past 10 years, we can see that the death rate has actually decreased by 10.4%. So that's really good that we're moving in the right direction when it comes to heart disease. And then over 5,800 South Carolinians died in 2021 from coronary heart disease. Again, specifically looking at the racial disparities, we see that 10.7% higher rate of dying from coronary heart disease than non-Hispanic whites, and 2.4% higher rate for Blacks compared to Hispanic population. Next slide. We'll jump into looking at prevalence of obesity. So when it looks to obesity over the 10 years, we do see that the rate has steadily increased for our state by 10.3%, with over a third of our population in South Carolina suffering from obesity as of 2022. And if we look at folks from ages 35 to 54, we can see they have the highest rate of obesity, with over 2 in 5 adults experiencing obesity at in this age group. And again, And when it comes to racial disparities, we can see at 36% higher obesity rates than non-Hispanic whites, and then 38% higher in the Black adults compared to Hispanic populations. Next slide. And if we're looking at our children, we can see it's estimated that 1 in 5 children are categorized as obese, and that 5th graders specifically have the highest rate of obesity at 26% being categorized as obese. So definitely some work that needs to be done with our school age kids. And then additionally, 16 to 18% of school age children are deemed overweight. So again, work needs to be done with our school age kids. Next slide. And so we went through kind of the data as far as kind of health status and what that looks like, but want to share some data as far as it relates to health behavior. So we'll jump into talking about healthy eating as a starting place, and then we'll move into physical activity. Next slide. So looking at, and this data is really survey data, the BERFIS data, and so it's really reported through surveying folks. And so in 2021, some of the data was really surprising to me as I was looking through it. 20% of South Carolinians reported not eating a daily serving of vegetables, whereas 42% reported not eating daily serving. I got that backwards. 23% reported not eating daily serving of vegetables, whereas 42% report not eating a daily serving. So there's still work getting folks to consume their vegetables there. And then if we really want to break it down, looking at educational level, which I thought this was really interesting, we saw that education level increases the likelihood of adults not consuming fruits and vegetables. So interesting data. And then the individuals that have less than a high school diploma see the 2.3% higher rate of not eating vegetables. So we said that there's a correlation between higher education and consuming more vegetables. Next slide. And so I think this is really good to give us some insight into why folks aren't consuming fruits and vegetables. The top 3 reasons, as you can see, too expensive, lack of knowledge, and just deciding to eat fast food regularly. And then 3 of the reasons why preventing folks from being physically active, 1, personal choice, lack of sidewalks or bike lanes, and a safety issue. This is interesting to have this insight into why folks are not eating healthy and why folks are not engaging in physical activity. Next slide. So we'll take a quick dive into what physical activity looks like. So we can see that in 2022, 25% of South Carolinians reported engaging in any leisure activity over the past month. So over a month period, only 1/4 of South Carolinians are actually engaging in any activity, which again, there's lots of work that needs to happen in that area as well. And as the education level increases, we saw the percentage of adults not engaging in activity actually decreases. Again, there's that same correlation between higher education correlates to more physical activity. And then those with a high school diploma see a 3.3 times higher rate of not engaging in leisure time physical activity. Next slide. So again, I know that was a lot of data, but I think it helps give context behind, as a state, where we are. So we'll delve into just some general recommendations and some tips and tricks to address some of these issues. And so I found this graphic. I thought it really spoke to me that fitness is 20% exercise and 80% nutrition. You can't outrun your fork. I thought that was pretty funny. And so why I think there's a misconception, especially when folks want to get in shape, they want to lose weight, they want to be healthier, they immediately go to I need to work out. And really, much of the focus should be around nutrition. And so most of our presentation today, we'll talk about nutrition. We'll certainly delve into exercise, but again, that 80% is really attributed to nutrition. And so that's where I think we should spend more of our time. Next slide. So again, I know, you guys on this call know this, but I think it's good just to remind ourselves of really what our daily intake should be. And so for years and years, I think generally speaking, we talked about having a 2,000 calories per day diet. And I think when folks really look at this deeper, people are actually consuming more calories than they think they are, right? And so I'll use this as an example. When you look at packaging for daily servings, typically folks, they read the label and see what the serving is, and they're engaging in consuming more than the recommended serving size. And so folks are actually consuming more calories than they think they are, which, again, leads to health issues, leads to increased weight. And so that is something I think we need to bring folks' attention to. It's really thinking about and paying closer attention to really their intake. And so could certainly give a whole presentation about reading labels, but again, today really is just centered around just kind of general recommendations. Next slide. So as it breaks it down to really what's your diet really look like? And so maybe to some folks, surprise, a lot of our, there's been a negative kind of connotation around carbohydrates, but really carbohydrates are certainly, depending on the type of carbohydrates, are actually not bad for you, right? It's a source of energy for us, whether it's just your daily energy that you need from doing daily activities to just thinking, digestion, whatever it may be. Certainly carbohydrates are important in our diets. And so really should be centered around those whole grains, those fruits, those vegetables really should make up most of our daily caloric intake. And then we also need to make sure we're having protein. So looking at lean meats like fish, turkey, chicken, eggs, dairy makes about 1/3 of our daily intake, caloric intake, and then fats. So again, there's always a negative connotation about fats, but certainly there's good fats, like in avocados and nuts and seeds certainly are the types of fats that we should be consuming on a daily basis. Next slide. So again, specifically, we're here talking about hypertension, and one of the drivers we all know is too much sodium in our diet. So I thought this was really fun to delve into, just kind of looking at different foods, which I'll go in the next slide to talk about really some examples of the sodium content in a lot of the food that we eat, which is really surprising. But as recommended by the dietary guidelines for America, we should only have 2,300 milligrams of sodium in our diet per day. Certainly, in certain risk groups like those with hypertension, diabetes, and kidney disease, really, and you guys know this, sodium intake should really be lower than the recommended amount. And so, of course, with that higher sodium intake, we see higher blood pressure and increasing risks of heart disease and stroke and so on. And so many folks, I think, don't realize just the sodium content in foods that we consume, like certainly in the processed foods, which we'll look at here in a second. There's lots of sodium in these foods, or just restaurant foods. So of course, restaurants. One of the ways they make the food taste good is pour a lot of salt in it, and so why it tastes good. Generally, eating at restaurants or fast food it's just not good for us at all. And then certainly there was those hidden foods that have lots of sodium in it, like our condiments and bread, and sauces. I'm a big sauce. I like sauces, and so have to really pay attention to not consuming too many of those sauces. Next slide. So this was really interesting. So I thought it was really good to pull some examples of some foods that are regularly consumed by folks and look at the sodium content is really high. So I know many times when people are sick, they go straight to chicken noodle soup, but as you can see, just 1 cup. So again, this goes back to typically we're consuming more than the recommended serving size. So this is just 1 cup of soup is nearly 1,800 milligrams of sodium. And so I would say it's safe to say that most folks are probably consuming more soup in a serving than just 1 cup. And so even just having a cup and a half, that puts you over your daily recommended amount of sodium. If we look at pizza, I love pizza, but just 2 slices of pizza is about 1,400 milligrams of sodium. Many times I'm eating more than two slices of pizza. And so it's really surprising how much salt is in the food that we consume. And this one was really, really surprising to me, looking at just a Chick-fil-A meal. And this is just the sandwich and a large fry. So I started out, when I pulled this data, just the sandwich and just the fries. And then I thought, wait, most people are also using the sauce, and most people are using ketchup as well. And so when we add that in, I mean, we're over 2,000 milligrams of sodium just in 1 Chick-fil-A meal. And that's just having 1 sauce in 1 container of ketchup. And this one was, I think, most surprising to me. I pulled this from Zaxby's, their fried Cobb salad, over 2,100 milligrams of sodium just in a salad, which, and many times people think salads is a healthy option. And certainly, depending on what you put in the salad, it can be a healthy option. But certainly, in some instances, it may or may not be the best healthy option for you. Next slide. So I guess the question is then what's the alternative? So I pulled some examples together of different ways to season your food that actually are tasty, and these are actually things that I do. So I wanted to provide some real life examples of things that people can do that certainly may not be their go-to as far as how folks can make their food tasty. And so I'm really looking at those herbs and spices. I use garlic powder, which means some folks I think don't realize there's a difference between powder and the garlic salt. I use garlic powder probably every day. I use onion powder every day. Things like paprika. I found there's a smoked paprika that has a little bit more flavor to it, which is a good option as well. And of course, the list goes on different spices that you can use other than just going for salt as your go-to. I think citrus juices and fruit. So one thing that I tried recently was seasoning just chicken breasts. Squeezing some lemon juice and lime juice over it with some Mediterranean vegetables. To my surprise, it was really good. So that's a good way to add some flavor to your food as well. And then of course, then your vinegar. So I'm a big fan of balsamic vinegars, and apple cider, a good example of making alternative coleslaw. So you would just get the cabbage and use apple cider vinegar and balsamic vinegar, add it to cabbage, and it's a nice coleslaw alternative as well. So there's different ways to make food still tasty without it being filled with lots of the bad fats and lots of sodium as well. And again, we're very fortunate these days to have a lot of salt-free seasoning. So I'm a big fan of the Miss Dash's season. And over time, they've expanded their options for Mrs. Dash. So I think, personally, and also working with the patients or clients that you guys serve, the Mrs. Dash lineup is a really good option. I went online and you can actually order a whole kind of package of them with different types of seasoning that adds. You have Italian, you can have smoked ones. So the Mrs. Dash, I'm a really, really big fan of that. And then, just a couple different options and different ways that folks can still have the things that they like, but maybe change up how we actually seasoning some of these foods where they're still tasty. And then lastly, I think one of the things that getting my grandparents on board with is a salt substitute as a way to still, again, add some flavor to our foods and help them continue to be good food. Next slide. So let's talk about alcohol. I know everyone likes wine and beer and having alcohol, but so this one, I think, so I didn't pull any kind of recommended levels of alcohol into your diet. I know there's still, there's some mixed reviews about alcohol consumption as well, but I think generally speaking, I think it's important to folks to know that alcohol can contribute to raising their blood pressure. And so just being really aware about consuming alcohol. And so again, I didn't really feel comfortable sharing kind of a recommended amount. And so I would certainly advise anyone to see their healthcare professional and have that conversation as it relates to alcohol consumption. But I think is what's most important for folks to understand that alcohol can directly and indirectly impact your health. More specifically, it can really lead to making unhealthy food choices. So, again, as you consume more alcohol, it can impair your judgment, leading to you maybe letting your guard down and consuming those high sodium foods. I know that's the case for me. I'm more likely to consume some fries or wings when I'm consuming alcohol. And so that's one of the things to consider is the direct and indirect impact of consumption of alcohol. And then, with excessive drinking, it also can reduce your motivation or energy to exercise. So, if you consume a lot of alcohol, you may not feel as well or may not have the energy to actually engage in some physical activity as well. So I did pull kind of recommended amount of consumption levels or what consider kind of a serving of alcohol. So again, people generally are probably consuming more than a recommended amount per serving of these types of alcohol. So that's something to also consider when patients are reporting their level of alcohol consumption. And I know you guys know this already, is generally probably higher than what they're reporting. So another thing to consider when we're talking about the impact of alcohol on your hypertension and your health. Next slide. Water intake. I know there's been a lot of, kind of debate around levels of water consumption. And certainly I think there's some general recommendations, again, as you can see here, for males, a little bit higher at 3.7 liters and for women at 2.7 liters. But there's there's just so many different factors that really impact the level of water consumption for you, right? So some may be your activity, right? And so again, you know I've notated here, with increased physical activity, your consumption level needs to be increased. We look at also your food consumption. So if you're eating things like watermelon melon and foods that have higher are more water rich, then certainly your water consumption is going to be higher than someone who's not. So it's really kind of depends on the person as far as if they're truly hydrated at the level that's needed. And so just a couple of tricks and tips around getting that consumption. So I love watermelon, I love cucumbers. So that's the way to get your water intake. And also having a water bottle. I know these days there's lots of different types of water bottles that folks are utilizing. So, filling that up every day and making a daily challenge for yourself to finish that water bottle every day is a way to get that water intake. And then, these days, people like to flavor their water as well. So I recently started adding fresh lemon and limes to my water just to give it a little bit flavor and mix it up a little bit. So just realistic tips and to help folks get that water intake in on a daily basis. Next slide. So I thought this is really interesting to look at, just kind of what your plate should look like, or what your consumption of different types of food should look like a day. I know I went over kind of your macronutrients, but really, as you look at this image, you can see that most of your consumption really should be around those vegetables, right? And then having space for your proteins, your whole grains, and your fruit as well. So this is, and I can share this image. This is a good visual, I think, for folks to see and share so they can understand what their plate should look like. I think, as American, we're very much big meat eaters. And so a lot of times our plates have a lot of meat on it when really we should be focusing on having more vegetables on our plate. So, just keeping that in mind as far as, what we should be consuming on a daily basis. Again, I can, these slides will be shared with you all, and there's any other resources I can share with you guys. I'll be happy to do that as well. Next slide. So I wanted to share. So I think it's important to, I'm here kind of talk, but also I think it's important to understand, like, show you guys that I'm walk to walk and talk, right? And so as we're talking about just general recommendations on what you should eat, I think it's important, and again, this is a whole another topic we can go into, is just moderation. I think folks, when they go down the road of either kind of trying to address these health issues or lose weight, many folks, lean on sometimes going to these crash diets. And really, I think our focus should be on changing kind of our lifestyle, right? And that may mean sometimes we are indulgent in foods that we enjoy. My one of my buddies and I, we get burgers the first Monday of every month. So that's something we can look forward to, but it's not, something we're eating on a regular basis, right? And so if folks can understand that we can balance having healthy foods, but also having the space to indulge in foods that we enjoy. So wanting really today focus on kind of some healthy options. So this is what I eat. I actually had this yesterday. So you can see this is a $10 bag of frozen vegetables from Costco, not seasoned, just regular pre-cut vegetable mix that's really convenient. It's healthy. It's affordable. It's a good option, I think, for eating healthy. I was a little skeptical about it at first because previously I just bought all my vegetables and cut them up, and so this is a much more convenient and affordable option. And so As you can see on the right, this is, I think, this is tofu. So it's the veggies with some tofu, and at first I was like, I don't like tofu, and I realized I wasn't doing it correctly. I didn't realize I wasn't pressing it correctly. There's some different ways you can season it, like I went over earlier. And so with doing that, it actually made it really flavorful. So again, another option, again, this is this balance of flavor, but also having a healthy option is typically I'll make a honey soy garlic sauce to put on it. So like I think it's a tablespoon or two of low sodium soy mixed with honey and some fresh garlic. And it makes a really good, tasty option. Rather than going out and picking up Chinese food, it's a healthier option for you. Next slide. Here's another option, making salmon in the air fryer. Again, using honey. I think this is just honey and some seasoning over some jasmine rice and some broccoli. Quick, simple meal. I typically can make this in less than 20 minutes. Air fryer and make some rice and throw the broccoli in the air fryer as well. Quick, easy, delicious meal. And yes, that's a glass of wine. Next slide. Another option. So you guys are probably like, what am I looking at? So this one was shared from my mom. So this is actually a alternative to chicken salad. So instead of using mayonnaise, you use avocado as kind of the base to hold your chicken together. So you just take avocado, let it ripen a little bit, smash it up really good. Got some cilantro, I did add a little bit of pickles and a little bit of salt, some lime. What else I got in here? Some pepper, some onions. So again, alternative to just switching out that mayonnaise and using avocado as a mix for you. So just again, another option. So I just taken this and just for some cool presentation, taking the avocado peel once I made it and put it back in there. So actually, my mom made some of this avocado chicken salad. I think for one of our holidays with our family, and I actually liked it. So again, there's ways to change out a few ingredients to make these meals a little bit healthier. Next. So just some practical advice as far as just shopping. And I know this is kind of something you guys have probably heard about, shopping around the perimeter of the store. So focusing on those fruits and vegetables, your meats, and stay out of kind of the center where you'll find a lot of the processed food. Of course, you have to go through the center aisles to get things like, rice or, high fiber cereal, as you see listed here. So general rule of thumb, shop around the perimeter. And I think this is a realistic and a good pointer to give to patients and clients that you guys serve. Next slide. So physical activity, as I spoke about before, 80% of your health really centered around your food, and so the other 20% around that physical activity. And so I know we only have 13 minutes left, and so again, real quickly, we know how physical activity can really positively impact your health, from improving your cardiovascular health to regulating blood pressure, weight management, enhancing metabolic health, and boosting your mental well-being. I know sometimes if I'm really stressed with work and really busy and miss a couple of days at the gym, I say I need to go work out. And typically going back, it just puts me in a better headspace. And so why I know physical activity really impacts us a lot from a physical standpoint. Certainly, I think there's benefits to our mental health as well. And so I think, I think that's a good way to kind of frame it with our patients is really physical activity is good for us from our mental physical and in some instances our spiritual well-being as well. Next slide. So I want to give some recommendations for physical activity. Again, I know you guys know all of this, but want to provide some tips. So generally speaking, we know we need at least 150 minutes of moderate intensity a week. So depends on what works for you. You can divide that up. You may want to do 30 minutes a day, or do it over 3 days, so whatever really works for folks. And so just want to provide some tips and some practical ways of getting this into your daily. So again, you can break it up. I think has impact on your mental well-being too. Taking breaks throughout the day, maybe go for a walk, taking the stairs, or going on walks or going biking as well. Park at the end of the parking lot. I know we're always trying to find the closest parking lot to the store, but maybe we should do the opposite and park a little bit further from the parking lot. Again, taking in safety, right? Depending on where you are, where it's appropriate, maybe parking further in the parking lot as a way to get in some extra cardio throughout the day. And then just add it to your routine. I know. So one of the things my mom started doing is every morning she gets on her walking pad. So it's become part of her daily activity before she starts her day to walk. And I put a picture of the walking pad. So this is a good alternative too, right? And depends on where your patient or community that you're serving, where they're from a financial standpoint. It's where it's appropriate. It may be good to recommend a walking pad if they are in a place that is not walkable or they don't feel safe. This is a way to, from the comfort of your home, be able to get in some of your cardio. I know in many instances you could be watching TV while you're walking, right? And next thing you know, you look up and you've walked 30 minutes already. So I think that's a good way to help folks get in their cardio every day, or an exercise bike is the way to do it too. And then make it social. So and sometimes when I meet up with friends, I'll say, hey, let's go for a walk, instead of, hey, let's grab a drink or let's go get dinner. Make it social as well. And then sometimes make it a competition. So I haven't done it in the last couple of years, but I used to do a 100-mile spring challenge with friends. And so we used the Nike Run app and got folks to sign into it, and we made it a competition, and also added a level of accountability where folks can see what you're doing. I think you can do this, with your Apple Watch. You can share your daily activity with your friends and family so they can see how much activity you've done. I know sometimes my mom says, well, I see you haven't gotten many steps in today, but this adds a level of accountability into this as well. And then the last two things are really around using apps and video. So these days we have so many apps and resources and videos. I know Peloton is really big, and I know that can be really cost prohibitive to a lot of people, but certainly there's lots of YouTube videos out there, which is free, is a way to kind of help people as well. And then again, setting goals and tracking your steps is an option as well. Next slide. Weight training. So this is another way, I think, to get in your physical activity. So try and do weight training 2 to 3 weeks, 2 to 3 sessions per week, and training those major muscle groups. Your arms and your legs, your core, and then again, generally speaking, 8 to 12 reps per set. I think if you do this, you're in a pretty good spot. And is really, to me, in this instance, is about consistency, right? So you don't have to be perfect at it. You don't have to be the strongest, but just doing this in a consistent manner. And again, I know we got a lot of our healthcare professions on here. Just having that strength can also help with falls, especially when we're talking about our elderly population as well. So a couple tricks and tips. Again, a lot of folks don't like to go to the gym, but you can do body weight training, doing push-ups and sit-ups and dips. There's many things you can do at home, right? And again, There's lots of resources and videos out there to help assist you in that. Where you can afford it, maybe a personal trainer is an option for you to help with accountability, but also maybe there's a lack in skill that a personal trainer can actually help out as well. And again, doing those home workouts and using free weights. You can get free weights at Walmart or Amazon. Again, you don't have to go to the gym. You can get these workouts at home and then using those free videos as guides from YouTube. Next slide. So again, just wanted to show, so I do a little bit of I do weight training and I do running. So that's just at my gym working out. But also, this is me and my best friend from college. We do the Cooper River Bridge run every year. So that gives us something we can look forward to, right? So we kind of create that community of, hey, let's sign up for this race. That gives us something we can work towards, right? So I had a friend years ago, she wanted to lose weight. And so some of her friends encouraged her to, let's sign up for a marathon together. And so through signing up for that and came up with a training plan, she lost 100 pounds training for that marathon. So that's a way that I think helps keep people on track when they have something to look forward to or a goal that they're trying to reach. Which your goal may not always be a weight goal, right? It can be completing a 5K or completing a half marathon or a competition or whatever it may be, or just different ways that can encourage folks to engage in physical activity. So next slide. So just to wrap things up, again, having that balanced diet doesn't mean having a perfect doesn't mean having a perfect diet, but having that balanced diet where most of your diets are healthy, right? But giving yourself the grace and flexibility to have those things that you like, right? Secondly, reducing that sodium intake. So just, again, working with our patients to understand foods, the type of foods that they're consuming and their sodium level, but offering them alternatives to reducing their sodium intake. Thirdly, increasing physical activity, whether it's walking with a friend, going to the gym, getting some alternatives or like a walking pad that they can use at home. I think we got to start thinking outside the box of how we encourage folks to engage in physical activity. Fourthly, maintain that healthy weight, right? So making sure we are keeping up, we're managing that healthy weight, we know where our weight is, and we have set goals to reach a weight that's appropriate for us. And then lastly, limiting that alcohol consumption. Then just, again, want to note, any of these instances, always advise folks to consult with their health care provider. Again, these recommendations that are provided today are just kind of generally speaking and not, certainly we know that folks who have specific conditions or pregnant or whatever it may be, certainly want to encourage them to consult with their doctor before making any kind of large or drastic changes to their diet and exercise. Next slide. And just to kind of sum it up, moderation is key to lasting enjoyment. So thank you all again for giving me an opportunity to share my insight into healthy eating and active living. And I think we got a few minutes 2 minutes to entertain any questions or comments.
So thank you so much, Monty. So for questions and comments, I was going to go ahead and have, if anybody does have any questions or comments, if we can have you guys just send those to our regional collab email, and then I'll make sure to get those over to Monty, and then we'll make sure to get those out to everybody that's attended, just so we don't keep anybody late and we respect everybody's time for today. If that's okay with you, Monty?
Sounds good.
Okay, perfect. If once we go through these 2 or 3 slides, if you have any questions and Monty can stay on and you can stay on, then we could always talk about that afterwards. But let me get through these 2 slides so we can let people go that need to go. So we have our case review reminder. We just wanted to remind you to please submit case reviews for each session. If you have any colleagues that have any case reviews, or you think that they would be a great person for me or any of our group to talk to for cases, please let us know. We'd be more than happy to reach out to them and talk to them and see if we can get them to present a case review for us for each session. Our next ECHO session is going to be Thursday, the 27th of February from 12 to 1 like normal. And it will be by Sylvia Coleman, and she'll be presenting reimbursement for auxiliary personnel services, exploring the new Medicare billing codes. And then our post-ECHO survey. So we have not been getting a huge response on the post-ECHO surveys. So we're just kind of reaching out to you guys. We are always looking for ways to improve our ECHO series. We want to make it the best and most informative that we can do. So we need your input for that, to let us know what's good, what's bad, what needs, what changes you think are going to be the best. And we really appreciate your input and all your suggestions. So Sydney's going to go ahead and put the link into chat. Also, you get that email that just gives you the REDCap survey link also this afternoon. And we would truly, truly appreciate your feedback, just so we can make sure we're doing the best survey, the best series that we can. And then from our team to all of you guys, we hope you stay warm and stay dry and out of the snow. And we thank you so much for participating. And then that is our email address. If you are not able to stay, and if Monty's not able to stay, then our email address, the regional collab at constellationqh.org, the one that we send all of our reminders through. That is the best way to get a hold of us, and we'd be more than happy to get those questions or comments over to Monty.
Thank you so much. Yep, I can stick around if there's any questions or comments.
Great. Thank you, Monty. Thank you again for your presentation and sharing your expertise. Thank you, Kathleen, for closing us out. I just want to say, it's when you shared the pictures of those meals, the Chick-fil-A got me, because that's something that our family, my son loves Chick-fil-A.
I love it
And
too.
you think, yeah. I mean, but when you think of it, like that one meal, like you said, it's your entire day's worth of sodium intake. And, it really teaches us the importance of just understanding what we're consuming. And something that was so important for us, I used to be a program manager in a health and hunger department for a food bank. And what we really tried to promote is understanding food labels and understanding the impact and how you can get that information. It was really important for a lot of our Hispanic community members, because they didn't speak English. And just really understanding how you could find that information and learn how to read a nutrition label was so important. And it's something, even for me, it's something I don't even think about sometimes, but I know the importance of it. So thank you for sharing those meals and the sodium in it, because it's astonishing when you see it like that.
Yeah,
It really is. Yeah.
it really is. And I think, to the point, it's like, we don't always eat the recommended serving size. And so when we may see that level of sodium, we're actually consuming probably double of that. And so it just kind of compounds that effect. So again, that could be a whole, lesson on reading labels. So yeah, I appreciate you sharing your insight into that.
I feel like Sylvia's coming off. Wait, she's trying. No? Oh, okay. All right. Does anyone else have any questions?
There we go. My
Oh,
computer crashed. That's why I was just getting on like right at the 11th hour. My computer crashed and now the equipment is not wanting to serve me well. But anyway, thank you, Monty. Great job. And as Rebecca said, I think your pictures and giving examples really, and that's what we have to do with patients and clients. I mean, it was important to us, and this is information that some of us, know and teach, but just making it, as Rebecca said, making it real for people, giving examples, because just giving a list, I know, with patients, clients, and even in my own family, it's like, what do you mean? Like, or just giving a list of the herbs and spices. Well, I've never used those before. Like, how would you do it? What combination would you do it? And that kind of thing. And the pictures are just invaluable, including the pictures of yourself participating in physical activity. It's just really engaging. So thank you for another excellent presentation.
Yeah, thank you. And that's one thing so one of the things I've been doing is taking pictures of the foods that I'm eating. So, often I'll have friends or family members saying, "Hey, can you help me? I'm trying to lose weight or, reduce my blood pressure." So I started taking pictures and saying, "Hey, here are the things that I eat. This was in it. It's tasty. I've cooked meals for my family." And they're like, "Oh, actually, that's really good." And I'm like, "Well, it has way less sodium. It's still tasty." And so just giving folks examples of still eating good food that's tasty but healthier for them. So I've been trying to do a good job of just taking pictures and cataloging the things that I eat. Most recently I started cooking like a burrito bowl. So I don't add any salt to the rice. I add no salt to the beans. I season the meat, add avocados to it, and then flavor it with adding a little bit of salsa and some hot sauce. So it's like the only sodium I'm really getting in that meal is from the salsa and the hot sauce. Whereas in many cases with a burrito bowl, there's lots of salt from everything. So.
And you bring a good point because, we can cook together, so we can experiment and share socially, but we need to remember the importance of cooking classes for patients and clients as well.
Absolutely.
Because sometimes they just don't have that experience.
Yeah.
They don't have the experience and they may not have the equipment. We have to remember, do they have stove, microwave, refrigerator, all of those things? And if so, then how do they use them? Because some people were not brought up like your mother and your grandmother teaching you. Not everyone grew up that way. So I think cooking classes are just so important from the nutritional standpoint.
Absolutely. I appreciate you sharing that.
Maxine, just a quick thought before I forget, because I'm going to have to run. I apologize. But Monty, thank you for such a comprehensive and really from the heart talk. And I think that's something that's so admirable. I'm jealous. Before I forget, maybe Maxine, for the future, maybe make a note, maybe not as a full IECO or whatever, but somewhere start the discussion in addition to what Monty's been talking about. I know he only had limited time anyway, is the importance of increased potassium in our diet. It's really the sodium potassium ratio. It is really underappreciated. It's just now being recognized in humans. We've known it in animals for 50 years. But now it's the importance is being recognized in humans as well. And it was just a thought because I've got to run. I was going to email it and it saves me an email. Thanks everyone for having me.
Thank you, Dr. DePetty.
Thank you, Dr. DePetty.
Yeah, and that's no, I appreciate Dr. Petty sharing that. There's this it was kind of difficult putting this presentation together because there's just so many. It's just when you're talking about healthy eating, active living, it's so multifaceted. And there's so many things to talk about when you're talking about vitamins or supplements. I mean, that's its own kind of category, or reading labels, and so it's a big topic. And so today I just wanted to provide a really high level kind of overview, and really drill in the importance of you know, giving kind of general recommendations on healthy eating, active living, as a starting place for people.
Yes, thank you. Thank you again, Monty. It was a really comprehensive and informative presentation. A great way for us to kick off the new year and get in the habit of better practices, including myself and my son. Got to limit the Chick-fil-A intake. But thank you again. As you know, so many have mentioned, your visuals were really impactful, and we were able to walk away with a lot of tools for us to apply with and how we engage with our community members. So thank you again. Thank you for presenting and for sharing your expertise, and thank you for everyone for joining us today. You guys all have a great day.